Good morning. Welcome to the Statewide Refugee Advisory Council Public Forum. My name is Sarah Peterson, and I have the honor and privilege of serving as the Washington State Refugee Coordinator. Please, thank you so much for taking the time to join us today. We're really very excited about the terrific content that we have prepared. And just to start with, we'll do a few virtual meeting protocols. All callers will enter the conference in mute. Please keep yourself muted during the panel conversation. There will be plenty of time to answer questions and ask questions. Feel free to use the chat box as an opportunity to ask questions and make comments. And if you would like to speak during the question and answer session, please take the time to raise your hand and we'll invite you to unmute. Today's public forum is being recorded and it will be available posted on our website and to anybody who asks. Hamed Hakim-Kel is our resident tech expert, and he is available to answer any of your questions for any technical difficulties that you may have. At this time, we invite you to introduce yourselves in the chat box. Please put your name, your preferred pronouns, your organization, and your position. And we look forward to seeing who is joining us today. The Statewide Refugee Advisory Council has been in existence since the early 1980s. And the mission of the Refugee Advisory Council is to help inform the Department of Social and Health Services about the needs of refugees in our communities. They do this by raising awareness and sharing their concerns on the experiences that they see in the work that they do. They help us to collaborate across state agencies and our legislature and across different areas. And they help to build recommendations on how we can better serve refugees and immigrants in our community. The Refugee Advisory Council consists of 13 different council members representing 6 of the different counties where we have high concentrations of refugee arrivals. So you will see that all of these people are represented today, and we're very grateful to them for their service and their volunteering to serve on the Refugee Advisory Council. Today, we want to talk and really spend a lot of time thinking about the Afghan humanitarian crisis and the resettlement of Afghan arrivals in Washington State. We've all been watching the humanitarian crisis in Afghanistan unfold over the past 2 months. And our federal government, in launching Operation Allies Welcome to help resettle close to 70,000 Afghans in local communities across the country, has invited resettlement agencies to participate in that effort. Washington State has been welcoming refugees since the late 1970s. And over the past 10 years, more than 30,000 people have arrived, including more than 4,000 people from Afghanistan. Washington State has 8 refugee resettlement agencies that partner regularly with the federal government to bring people to our local areas. And our office partners with more than 60 different organizations across the state to provide ongoing long-term integration supports. These services include helping people to get jobs, helping people to learn English, receiving health screenings, getting enrolled in schools, and finding supports in their local communities. Our communities are experts in welcoming refugees, and they have a ton of strength in doing it. But the Afghan situation is different than what we've experienced over the past 10 years and over the course of refugee resettlement in general. And it's different in 3 key ways. The first is the number of people are arriving. The second is the timing of their arrival. And the third is their immigration status. We have received approved capacity from our federal partners to welcome about 1,679 people. This number is based on the initial allocation of 37,000 people. We anticipate that this number could be higher And refugees are expected to start arriving in the beginning of October, and we could see high volume of refugee arrivals or a surge of arrivals throughout October, November, and December. We are uncertain of how many people will arrive at any given time period, and refugee resettlement agencies may only receive 24 hours notice that someone is coming. Because of the way that the United States are bringing in high volumes of Afghans to the United States for their safety, they are receiving an immigration status that does not have the same benefits as if they arrived with refugee status or if they were granted asylum. They will be resettled through the Afghan Parole Assistance Program, which provides them the same type of immediate resettlement services that refugees receive, but they are not necessarily eligible for all other federally funded programs. And with all of these challenges that this operation brings, the Refugee Advisory Council wanted to convene a group of local experts to talk about what is happening in Afghanistan and how Washington is preparing to welcome our newest neighbors. So I'm going to stop sharing. And we are joined by 3 amazing women today who are leading Washington in welcoming Afghans. And I'm going to introduce each one of them and ask them to share information about their organization and the work that they are embarking upon to get ready for new arrivals. All right, first I would like to welcome Anila Afzali. Anila serves as the executive director of the American Muslim Empowerment Network, a program of the Muslim Association of Puget Sound. As an Afghan American herself, Anila is a passionate leader that is working to build coalitions and mobilize allies to come together to welcome Afghans to our local communities. She is a board member of the Faith Action Network and sits on the steering committee of the Washington Immigrant Solidarity Network. She has a powerful and thoughtful voice in approaching this humanitarian crisis, and we're very excited to be partnering with her. Anila, can you share a little bit about the work that you are organizing and respond to the Afghans that will be arriving in Washington State?
Yes, thank you so much, Sarah, and good morning, everybody. It's an honor to be here with you all today. I just wanted to start by acknowledging that as an Afghan American, I have an experience that so many other Afghan Americans are currently going through as well. And that is an experience of trauma and tragedy and horror and shock and anxiety and so many different emotions right now, because so many of us are directly impacted. I myself have 26 family members I'm trying to evacuate from Afghanistan, and the whole process has just been a colossal mess, to say the least. But I just want to acknowledge that and say that we are operating to the best of our abilities, but it is a really, really difficult time. But one of the things that gives me hope and inspiration and has been life-sustaining for me has been seeing the outpouring of support from community, from organizations, and more people, individuals stepping up, wanting to help out. And that's part of why I wanted to get involved in this work to try to coordinate some of the work that's happening here in our state. So one of the main things that we wanted to do is, in recognition of the fact that we're going to have an influx of Afghan evacuees arriving here to our state, we wanted to, and working in coalitions, really wanted to have a way to coordinate some of that work in order to avoid duplication, maximize efficiency and effectiveness, and strive to provide services that are culturally competent, that are religiously appropriate, and language literate. And it's in that context that we wanted to see how we could partner and work with the various resettlement agencies that are on the ground, but also bring in the services, the resources, and the opportunities provided by community-based organizations that have also been working on the ground for over the years to welcome and integrate Afghan refugees along with other refugees from different countries. And that's the context in which I'm with MAPS. So the Muslim Community Resource Center is one example. That's the social and humanitarian program at MAPS. They've been working with refugees. Of course, the Afghan Health Initiative, and I'm glad to see Ariana here, who will be speaking speaking shortly as well. But it was really an effort to bring those groups and many other community-based organizations together to talk about how can we prepare ourselves for this influx and really provide the support to the resettlement agencies, because they're not going to be able to help everybody for as long as we would, of course, want to see the help provided, and that is really needed to make sure that our incoming Afghan neighbors and families really are set up for success. And part of the problem is the way the law is set up and the context in which a lot of these Afghan evacuees are arriving here in Washington state. And that is as humanitarian parolees. So under that program, as Sarah mentioned, they don't get the same kinds of benefits that they would under the traditional program. So we decided to bring together community groups to create a little bit of infrastructure that we could leverage, that we could use to serve those who might not get the same benefits from the resettlement agencies, and to serve those after the time that the 90-day period of initial support that the resettlement agencies can provide to the incoming Afghan refugees. So we've done a lot of different things, and we're trying to bring a lot of organizations, community-based organizations, service providers together under the name of Afghan Refugee Collective. So this is a Washington statewide kind of effort. And as part of this Afghan Refugee Collective, what we have is we have a centralized intake form for anybody who wants to help, who wants to support this effort. And that's a Google form that I will drop in the chat. That's our starting point for anybody who wants to get involved. And in that form, you could identify exactly what services, what goods, what volunteering, what advocacy you're willing to engage in. And we've developed teams of volunteers under each one of those different categories. And as the needs arise, as we need volunteers, as we need interpretation, as we need goods, we've been issuing calls for that. We also have been using that as a way to communicate different advocacy efforts that people can help in terms of changing the law to better support the incoming Afghan refugees, like the disparity between the humanitarian parole designation and the traditional refugee benefits, as well as other changes in law that need to happen, or in foreign policy as well. And there's a link that I'll also provide for specifically related to advocacy efforts that every single person can support in doing our best to welcome the incoming refugees. In addition to our groups of volunteers working on coordinating all of these efforts, we've gotten well over 1,000 responses to our Google form, and we are working on following up. So just be patient with us. And also we have certain limitations like storage, so we can't accept all the goods right now. But the idea is we want to have this infrastructure in place. We're creating different working groups, working with Sarah and specifically working with the state and other organizations as well to try to build out this infrastructure of support. We have some refugee resource booklets that we've translated into Dari and Pashto. Those will be distributed along with welcome kits for each of the incoming Afghan families. We have welcome signs that say we stand with our we welcome our Afghan neighbors as part of an effort to really provide a welcoming environment, because even though right now it's beautiful to see the bipartisan support for helping and welcoming Afghan refugees, we also know and are already seeing the many instances of hate and people promoting a very xenophobic message as well. In addition to that, we have a joint campaign to raise money, to raise emergency funds. And this is a joint campaign between MAPS MCRC, Afghan Health Initiative, SCM Medical Missions, Kids for Peace, Refugee Women's Alliance, Afghans of Seattle, and more. And I will include that link in the chat as well. That is to provide some of the immediate needs, like the emergency housing assistance that these families may arrive, and we may not have enough time to get them permanent housing, or the resettlement agencies might need help in supporting them in providing some of that temporary housing or some other needs that they may have. That those emergency funds will be used for those incoming families. 100% will go to them. So that's what we're also sort of using as a way to support this work. Bottom line, we want to work with the public agencies, elected leaders, and more. And I've been in conversations myself in the context of working with King County, working with the governor's office, working with the state, the Department of Health, DSHS, and more. And we really want to create a unique public-private partnership that can be the best system we can get in place to serve and support the influx of Afghan families families that we will have arriving, but then not just to benefit Afghans, but really improve the system for all refugees and immigrants here in our state. That's the hope, that's the vision, that's what we are striving to work towards. And we really want to see this as an opportunity for Washington to come together, to rise to the challenge and really create an impact and a model for the rest of the nation. So thank you very much. I look forward to talking further about this and of course, working with all of you on some of the things that I described.
Thank you so much, Anila. We are so looking forward to partnering with you and the Afghan Refugee Collective and everyone to work together. And we do share in your vision of really creating a strong and improved infrastructure to welcome all refugees and immigrants into our local communities. Next, it is an honor to introduce Ariana Anjas, the co-founder and senior director of the Afghan Health Initiative. As a second-generation immigrant, Ariana is native to Kent, Washington, and earned a master's degree in public health from the University of Washington. She's been active in serving the Afghan community in South King County and works to promote social justice and equity for all refugees and immigrants. Ariana, welcome. We know that the Afghan Health Initiative has been very busy in building an infrastructure to welcome Afghans to our community and working with all of the people that have already arrived in South King County. And we know that you're working to welcome those that will be coming soon. Can you tell us more about your organization and the work that you're doing?
Hi, hello everyone. I'm Ariana. Thank you so much, Sarah and the Refugee Advisory Council and all the participants for providing me space to be here. Afghan Health Initiative is a grassroots nonprofit organization in the state of Washington. We were founded by current and former immigrants and refugees who are trying to navigate the complexities of their new lives. We're an organization with lived experience, catering to the needs and changing needs of the health disparities facing Afghan immigrants in our community. AHI, we provide culturally proficient, linguistically appropriate social support services, health promotion advocacy to immigrants and refugees from Afghanistan, as well as our neighboring communities in King County. Our mission is to serve the immigrant and refugee population in Washington state by promoting community-based public health interventions, which target social determinants of health, and to increase the equal access to health, education, and economic independence. And we also hold a strong commitment to ensure that the voices of the Afghan refugee populations are not only heard, but they are counted in data, and their needs are known and met through equitably, culturally, and linguistically appropriate preventative health and social services. We were founded to help immigrant and refugee populations maximize their potential towards a better future, while acculturating into their new lives in the United States. And to help facilitate this vision, we provide a host of social service tools and programs to be able to promote well-being and healthy life trajectories and self-sufficiency in our community. In regards to welcoming our new community members, we first and foremost believe in the power of community and the power of social supports as a sustainable option for newly arriving refugees to attain overall wellness and self-sufficiency in the US. We do this through a series of welcoming events, Khosh Amadid, which in the Dari language means welcome with happiness. We're very culturally familiar, and it's very culturally familiar to be able to introduce these individuals to the community through an informal event that is, through the culture. And it really is to introduce the community members to our community champions, our systems navigators, and AHI services. At our last event, we also had the opportunity to facilitate access to receive COVID vaccines with the Department of Health, among many other vaccines that they may have needed. For years, AHI has worked as an extension to resettlement assistance, compiling resources, including emergency financial assistance, information, basic needs, including children's items, groceries, and more recently, compiling 1,000 temporary host homes to be able to connect them and respond to this need. Moreover, we further assist community members along their journeys to the United States through weekly informal mental health support groups for youth and women. These are the resources that we are currently providing to our newly arrived community members. Finally, I wanted to emphasize that AHI is here for the life of our community members. And we have clients who have become friends and come to us for many of their needs, whether they've been here for 1 day, 1 year, or 10 years. Thank you.
Thanks so much, Ariana. It's amazing to hear your strategies and your vision that you have to really being a strong spot for a strong place to welcome Afghans. And our partners at the Department of Health shared the amazing event that you hosted last week. And we're just so grateful to have you as a partner in our communities. I'd like to go ahead and invite Cordelia Revels to join our conversation. Cordelia is the Director of Refugee and Immigrant Services at Jewish Family Service. JFS is one of 8 refugee resettlement agencies in Washington state that are preparing to welcome Afghan arrivals through the Afghan Placement Program funded by the Department of State. I've had the honor and pleasure of working with Cordelia for many years, and she brings so much expertise and integrity to the refugee resettlement process that it's a real honor to share, to have you on our panel. Cordelia, can you share with us what JFS is doing to get ready to welcome the Afghan arrivals?
Sure. Thank you, Sarah, and thank you all of the participants for being here today. So as Sarah mentioned, Jewish Family Service is one of the 8 resettlement offices that currently welcome new refugee families in Washington state. All of our offices have the same contract with the federal government to provide initial support services to refugee and SIV and now humanitarian parolee families when they first arrive to the country. We provide services such as assisting families in moving into their first home, setting up the basic furniture that they need, connecting them with any benefits that they're eligible for, helping children register for school, parents register for English class, making sure everyone has a connection to a health screening and a family doctor, and also helping employable adults look for jobs so that they can become financially stable as quickly as possible. The federal government provides funding to the resettlement agencies to support families for the first 3 months that they're in the country. Like all of the other resettlement agencies locally, our team at JFS has been working really around the clock to prepare for these newly arriving families. While many of us have been resettling families from Afghanistan for years now, as Sarah mentioned, the current crisis in Afghanistan means that we're currently receiving much higher numbers of families in a very short time period, with not a lot of time to prepare for each family's arrival. Additionally, under the Trump administration, refugee arrivals into the country were dramatically reduced, so all resettlement agencies around the nation shrunk in size over the last 4 years. While we, like many other resettlement agencies, were preparing to increase our program and staffing sizes more slowly over this next year, the crisis in Afghanistan has sped up this timeline dramatically. For instance, for the team at JFS, we received more individuals arriving in the last month than we had received in the previous 10 months combined. So like many of our partner resettlement agencies here and in other states around the country, we're working as hard as we can to hire and train new staff so that we can provide the support these new families need, while also providing the support that the families need as soon as they arrive, even though we don't yet have the staffing in place that we would like to have. While we're working as hard as we can to provide the support, we also know that we really are going to need to rely on our partners and community members, as Anila and Ariana have mentioned, to make sure that these newly arriving families have a successful transition to the country after what has been an incredibly traumatic evacuation process. I look forward to working with all of you and helping support these new families in their adjustment to Washington. And as my fellow panelists have mentioned, look forward to this really being a model in the country for supporting not only the newly arriving families from Afghanistan, but all refugee and immigrant arrivals to the state.
Thank you so much, Cordelia. We really appreciate all the work that you and your team are doing to make this happen, and especially knowing that it's a very different time period. And I do think that it's so important that we're working together and we're really trying to build a better infrastructure. And that's why it's awesome to have Anila and Ariana joining us as well. So I'm going to go ahead and ask, my next question is for all three of you. And maybe we'll start with Cordelia and then have Ariana go. And the question is, what would be the most immediate challenges if there's a large influx of Afghan arrivals into Washington state? Through all the work that each of your organizations are doing, are you seeing any gaps in services or challenges that you are seeing in the community as we prepare to welcome more people?
Yeah, I think from the Refugee Resettlement Agency perspective, I mean, one of our largest challenges is making sure that we're staffed adequately to support the resettlement services of these new arrivals. Resettlement case management is not easy, and we want to make sure that we're hiring staff who have the linguistic and cultural competency skills needed to really support these families. And so, being able to bring on the experienced and talented staff to do this complex work is one of the largest challenges we're facing. And then, of course, I would also say that, especially in the Puget Sound area, the challenge of affordable housing, which is not a new challenge, but will be exacerbated by how quickly these families are arriving and how little notice we have to secure housing prior to them actually arriving.
Ariana, what are you seeing as the biggest challenges or gaps in services?
Yeah, so what we're hearing, what we're seeing is that, there's going to be an overwhelm on the systems. There's not enough financial resources, tangible resources, and bodies to help facilitate smooth resettlement process in the United States. As Sarah mentioned earlier, it's not something that we've seen before in our history here about welcoming so many so quickly. In terms of our organization, we don't have enough staff and resources to serve everyone. However, we're relying heavily on our community. We have over 6,000 community members in King County who, we have and we've touched their lives. And, a lot of them are stepping up to serve the community, and they're saying, this is how I can help. We want to be here because, someone was there for me at one point. And so for years, the Afghan communities have come here. We've connected them with newly arriving members and a community champion. So someone who is willing to be a buddy, someone who is willing to be a friend and support system to field questions. But that's not always going to fill every single need. It's not fair to put this need on the community. We need systems, we need governments, we need our elected officials to step up and to be able to help support that. And, as Cordelia mentioned, permanent safe housing solution is a looming issue.
Anila, what are your thoughts about the gaps in services and the challenges that we may face as we welcome more arrivals?
Yeah, I definitely agree with Cordelia and Ariana, and specifically that immediate need of housing, both temporary and long-term, and also in places where they can connect and be best set up for the success, future success as well, is going to be a real challenge. The other thing that I'm seeing as a gap is exactly what we're trying to do, which is build some infrastructure and have it be long-term and sustainable to actually support the resettlement agencies in their work. So I feel like that is a gap that's missing. And there's been a lot of support expressed by individuals, by community groups and more, but finding a way to connect all the people who are showing this beautiful goodwill right now with the ways that they can help and actually have a system in place that can facilitate and streamline all of that. So I see that as a gap as well. The other big issue that I'll just mention quickly is trauma. There's so much trauma in the incoming Afghans, in the Afghan American community, and finding ways to address and best resolve some of those issues and provide the best resources to do so is going to be significant. But I agree with what Cordelia and Ariana said, and especially Ariana's point about needing to have more investment in the organizations, in the work that's on the ground doing the work.
You bring up a really good point, and I think you've mentioned it a couple of times, Anila. So I wonder, Ariana, given your experience in public health and the work that the Afghan Health Initiative is doing, what are you seeing is the state of mind for arriving individuals and families? What are they missing and concerned about? And what can we do to better support the Afghan community in Washington as it relates to mental health and community supports?
Certainly. What we've been hearing from families is that, it's definitely a mixed signal. For one, they are very thankful and very hopeful of being here, escaping from Afghanistan, being one of the lucky ones. But on the other hand, they are also afraid. They're leaving everything that they've ever known behind. Some of them were really wealthy in Afghanistan. They have degrees, they have lives, and a lot of them are also leaving their family behind. How are you supposed to navigate that, between one piece of you being here and one piece of you being back home? And so the worry is huge. And I'm really afraid for the mental well-being of our community. Prior to, there was less trauma and less stress as they were coming here, whether it was an SIV status or a different method. But right now it was really traumatic. And so a lot of people are telling me, I will never forget the sounds of the gunshots, the sound of the bombs at the Kabul airport. And so that's really one of my biggest concerns and one of the biggest things that we're hearing. And then we're also hearing from community members saying that, we're already ready to work, but where's the work? Where am I going to find these jobs? And we are in, a global pandemic. Here in King County, many people are, facing the eviction moratorium expiration, right? We're going to see a lot of that housing instability, and there's a lot of people who are struggling to find jobs who have already here. So how are we going to expect that our community members who are coming here, who don't know the systems, within 90 days that they're supposed to get on their own feet? It's really, it's an unfortunate situation, and that's really what we're hearing. And in terms of what we can all do to support the Afghan community in Washington, I highly encourage, if you are an employer, if you are someone who has jobs, and you can reach out to us. We're collecting jobs right now and sharing it with the community. Someone who, can be able to provide extra training, who knows that, English may not be their strongest suit. Please reach out. In addition, if you have housing, if you have like a rental unit that's empty, please reach out. Of course, these are the two biggest needs, and, really important towards their self-sufficiency in the United States. So these are my two points. And then for everyone else, if you aren't able to provide this assistance, Anila has shared, forms in the chat where you can volunteer whichever way that you can. And, if money is not on the table, then, provide your time. And if anything else, please use one of those welcoming signs, put them in your door. Anila will have more information about that, as she mentioned, but just let them know that they're welcome here and that you support them.
Amazing, Ariana. And one of the things that DSHS is working on is we have been hearing from many different employers that they're interested in hiring people. And we have a network of organizations that provide employment and job training. So we're interested to partner with you and with everybody on the panel and with all of our partners to really think about what does it mean to help people get that first job and then continue to get ongoing better jobs to have a living and wage so that they can have be economically stable. So that's an excellent conversation. Cordelia or Anila, is there anything you'd like to add to what you're seeing on the ground and how people are feeling and what you're hearing from the community?
Yeah, I think Ariana really described it so well in terms of the mental health concerns of these new arrivals. And I think for a resettlement agency, it's not common that we're working with folks who are being evacuated from like a current war zone, and the impact that that's having on these new arrivals, and knowing that they've left so many of their loved ones behind, it really can't be overstated. And I think we're really lucky to have the mental health partners that we have in our area, but also know that there's just going to be a tremendous need for support for these new community members, as well as the Afghan American community here who as Anila mentioned, all are, have experienced their own traumatic path to the United States and have family still in Afghanistan in danger.
I agree with, I think Cordelia and Ariana covered it well. The only thing I would add is something I put in the chat, which is that folks who arrive here as humanitarian parolees, they actually have another burden on their shoulders, which is to apply within a certain time frame, usually a year, to apply for adjustment of status, because as humanitarian parolees, they're only granted temporary status here to be in the United States. So that's an additional burden that they have to think about right away as soon as they arrive.
Excellent points. Thank you so much. Ariana, I think that you elevated the idea that this is really impactful to all of the existing community. And Cordelia, I want to ask you a question about how resettlement agencies work to provide services that are responsive to the Afghan community, and especially in light of the current trauma. And I understand that the crisis in Afghanistan impacted your own team. And I wonder if you could share for a minute a little bit about your experience and how you're really working to support and provide culturally responsive services.
Yeah, that's a great question. And I think it's something that is so critical for the resettlement agencies to ensure that we're doing. I think for JFS, one of the most important things is that we are hiring from the communities we're serving, and that we're able to provide clients with that linguistic and cultural understanding when they do arrive. I think, I don't come from a refugee background myself, and I've been so grateful to my many colleagues who do and have shared their experiences and their knowledge with me, not just in this crisis, but over the years as we've worked with families coming from Afghanistan. I think also, in addition to having staff who come from the communities that our refugee families are coming from, having those close connections with community-based organizations that are really rooted in the communities, such as the other panelists here today, and we have many other partners, both working with Afghan community members and other refugee and immigrant groups. And those connections are really essential, because the resettlement agencies, I like to think we play an important role in the journey for new families, but we know we can't provide all of the support families need, and they need support for far longer than we're able to provide. And so it's really a critical component of our work to make sure that these families are connected to other organizations in the communities who can provide additional guidance. And yeah, for our team specifically, we actually had one of our team members, one of our case managers who works with our Women's Empowerment Program, was in Afghanistan, in Kabul, when Kabul fell, and she had returned to support her 3 children through the final step of their visa process, and unfortunately Kabul fell and they got stuck there. And so for the first few days, it was, just really terrifying to hear from her what they were hearing the Taliban was doing, going door to door, talking with her about what documents she should keep, what documents she should destroy, if she should try and get to the airport, how to get to the airport. And then I think, as Anila and Ariana both mentioned, just hearing from her about what it was like at the airport trying to get in, just begging to be let in. And this was a family, of most family members had green cards. And so it should have been easy for them to get through. And it was just such a, even for me as a bystander, just trying to provide the support I could, it was a really terrifying experience. And I can't imagine what it was like for my coworker and for so many of the other families. And again, these are the lucky families that did get in and did get through. And we know that there are so many more families who didn't get through and who still need support to be evacuated, both those coming through the special immigrant visa pathway, but also those who aren't eligible for SIVs. And So as Anila mentioned, there are really critical advocacy efforts so that we can hold the US government accountable to the commitments we've made, not just to the SIV community, but for our values in supporting, humanitarian concerns.
Cordelia, I want to thank you so much for sharing your experience and telling us a little bit about the experience of your colleague. I think that it really does hit on the challenges and the trauma and what we're hearing and seeing from our Afghan friends and neighbors and colleagues. And Anila, I wonder if this might be a good question for you. Given all of the information that's out there about the Afghanistan crisis and for the general public, what can we know and what can we better clarify about how to prepare our communities? And is there already an education campaign or outreach to the receiving communities? And what can we do to really help people be aware of the different traumas and experiences for people that are interested in the public and how we can better help people as they come into our communities?
Sure. So I would say one of the biggest pieces of advice I would give is to listen to Afghans and Afghan Americans. I feel like a lot of times in conversations, in roundtables, in policymaking, in strategy decisions, some of the directly impacted community members are missing. So hearing directly from Afghan Americans and Afghans generally is important. I'll also point out, I did mention earlier the welcoming sign. I know Ariana referred to it as well. And specifically, we do have this. I have 1,000 copies printed. I know I've given it to the Port of Seattle as well. We're going to distribute it widely. And we would love individuals to put up these signs in their homes, businesses to put them up sort of where they can. And I'm just going to show it if it's okay, if I could just share my screen, Sarah. Folks can just see, this is our welcome sign. It's a basic sign. It's similar to a campaign that we had to combat anti-Muslim sentiment that we experienced with the rise in Islamophobia, where we said we stand with our Muslim neighbors. This is a similar format that just welcomes our Afghan neighbors. And these kinds of signs really make a difference on the directly impacted community members, and especially when they are also seeing or hearing news like this, the kind of horrible, flip side of that xenophobic content that exists out there is also being promoted. So I want us to do what we can to really magnify and amplify a narrative and a message that is welcoming. And I'm also going to point out in terms of misinformation, I think it's really critical for people to know who these Afghan evacuees are. I've been seeing some content, for instance, in media about, only this small percentage of folks are SIV and the rest are not. But the reality is, when there's one SIV in a family, and not just immediate family, but the extended family is actually endangered because of that individual SIV, that individual interpreter or assistant who helped the US in our mission in Afghanistan. So they actually sacrificed, they put their whole family at risk, in danger by supporting the US, and now they are facing retribution by the Taliban. And it's not just them individually, it's their entire extended family that faces that threat. So they are all in danger. So when they are arriving, even if one person out of 8 might be the SIV recipient, it's the entire family that has to come with them, because we put the entire family at risk. And a lot of these people are not arriving as, sort of some sort of handout that we're giving them. These are promises we made as a country. We promised them safety, refuge here in the US if they supported us, if they stood with us. Many of them gave their lives for our soldiers. Many of them gave their lives and safety and well-being of even their family to support our mission. We owe this at the very least to them. We're already breaking the promise to so many other Afghans who we're leaving behind despite our promises. The very least we can do is welcome the fortunate few who do make it here. And the final point of sort of misinformation out there that I want to emphasize is understanding that we cannot conflate what the Taliban are doing with Islam. A lot of people are doing that, and that is absolutely not only wrong, but it results in real harm to Muslims here in our country, and it promotes Islamophobia. The Taliban are practicing a perverse deviation of Islam, just like we would not call what the KKK is doing or the Lord's Resistance Army as an example of Christianity. We should not conflate the Taliban's repressive, brutal behavior with Islam or Sharia, which simply means Islamic teachings.
Anila, thank you so much. And there have been several questions in the chat about how to get a copy of that welcome sign, including for myself. I'd love to know. So if you could share that information with us in the chat, that would be amazing. We've received a number of questions from our wonderful attendees today, and we've asked Lenny Orlov, a Refugee Advisory Council member who also came to the United States as a refugee, to help us to answer or to help us to ask some of these questions to our panelists. Lenny, what question would you like to ask first?
Yeah, thank you so much, Sarah. It's an honor to be in the presence of this panel. And thank you for everybody for your questions. The first question that we received was, how will the medical non-coverage be dealt with while parolees need medical and mental treatment for PTSD?
And I'm going to allow Ariana to answer that question, but we also have Jasmine Matheson on the line who will be talking a little bit about that in our next section. But Ariana, go ahead.
Can you hear me? Apologies. So what we're hearing is that the state is going to have an insurance type program where they're able to get emergency insurance. But of course, I'll let Jasmine really defer to that question in terms of more information that's more accurate.
Does anybody else on the panel have anything to add? Okay, well, thank you, Ariana. Question number 2 is specifically for JFS. And the question is, do you have staff that when people call, when people contact you who speak Dari or Pashto, so that refugees can talk to them and ask questions and get the needed help in their language?
Yeah, definitely. Then that's a really important part of our work is language justice. And so we do have a number of staff who are from Afghanistan themselves, who speak Dari and Pashto and several other languages that are common to that area. In addition to that, all of our staff have access to a language line that we can use at any time. So if a client is working with a staff member who doesn't speak Dari or Pashto, we can provide an interpreter over the phone at any point that's needed. And similarly, we have a number of other languages on staff for many of the other common refugee and immigrant groups in the area. So very, very committed to making sure that clients can communicate easily and get accurate information.
Thank you so much, Cordelia. And full disclosure, when my mom and I were resettled back in the 90s, it was an agency that is from the JFS family of agencies. And I used to work for JFS for almost 7 years. So definitely have a connection and a great experience with this organization. Moving on to the next question then is number 3 is, I heard that King County will use an extended stay hotel that they purchased previously to house incoming Afghan refugees. What is the status on that housing?
If no one else has an answer, I can try to attempt to answer that. Yes, this was an extended stay in Federal Way that will be used. There's about 100 units in that hotel, and they are doing some final work that needs to be done to get it set up. But I believe it's going to be active as of next week as a temporary place to house incoming Afghan refugees. I believe next year the use will be for something else, but at least for the immediate temporary needs of the incoming refugees, that will be one place. Nora said in the chat that it should be up and running Monday. Great.
Yeah, thank you, Anila, and thank you, Nora, for chiming in the chat there. We appreciate the confirmation. Let's see, there's another question for you, Anila, actually, and that is, can you provide info on Humanitarian Parole, which recently opened to file as sponsor or use fee waiver to urgently bring family members?
Sure. Just to clarify, humanitarian parole has been an option in the past. It just has not been used, and now it's being heavily used by Afghan evacuees, given the fact that the humanitarian parole process is supposed to be a lot faster than the typical refugee processing of things like special immigrant visas, P1, P2, or the other options that people use. Just by way of reference, a family member of mine applied for special immigrant visa in 2018. They still haven't gotten final approval. So that gives you a sense of how long that process is. So a lot of people are now applying for humanitarian parole because they need to evacuate danger. They need to evacuate quickly because they are in hiding. They are, being pursued by the Taliban and more. So that's why humanitarian parole right now is a very, very big topic of conversation, and it's being heavily used. And it's typically supposed to take, 1 to 3 months, but with all of the people applying now, that processing time may also be extended, unfortunately, so that people remain in risk in Afghanistan. But some of the things specific about humanitarian parole, we mentioned it earlier. People who arrive under the humanitarian parole designation, they don't get long-term ability to stay in the U.S. They have to adjust their status once they arrive here. They're not entitled to the same benefits as a traditional refugee resettlement program. And there's other complications as well, including with the actual application process. I'm going through this myself for my own family members. First off, you have to pay $575 per person, per individual in a family. A 2-year-old toddler has to also, for a 2-year-old toddler, you have to pay $575 application fee. I have 26 family members I'm trying to evacuate, just to give you a sense of what it's like. That's about 15 grand. $15,000 just in fees to even have a shot at potentially saving their lives. So there is an effort to try to get these fees waived across the board, but right now they do exist, and there are efforts, private efforts, to try to do fundraisers to raise some of the money for people who need to apply for their endangered family members, but don't have the funds to actually pay that $575 per person fee. So that's one thing that people can help support the fundraisers for those fees. The other piece of it is, as part of the humanitarian parole application, you have to show financial documentation and financial sponsorship, people or organizations who are willing to actually financially support the humanitarian parolees once they arrive here. Now, those currently are not legally binding documents by any means. At the same time, they do require financial information that individuals or organizations have to provide, and they have to affirm and sign a certification as the sponsor of those individuals. And a lot of families need people to step up and sign up as financial sponsors, again, for them to even have their application considered to be able to bring their at-risk family members or loved ones here to the US. And if you, again, sign up on our Google form, we send out regular updates that includes information about fundraisers and different ways to advocate on this issue of humanitarian parole. And specifically, it includes a fundraiser for helping support vulnerable Afghans who cannot pay that $575 fee. So I will put the link again in the chat, and I'll also include our newsletter from last time that has some information under the support for Afghan refugees section.
Thank you so much, Anila, for such an impassioned and detailed response. And I see people in the chat chiming in that they are experiencing these hurdles as well with financial sponsorship. And I want to actually go to somebody who has had their hand raised very patiently here in the chat by the name of Dory Lusso. Let's see, would you like to ask your question? Go ahead and unmute yourself. And if you want to go on camera, go ahead. So while Dory, while you're getting your microphone to work, we have one quick follow-up here. Kelly asked, I'm curious if anyone has information about churches sponsoring families for humanitarian parole. Like, is it possible for churches to do it, and is there any legal guidance?
Definitely churches or any organizations can do so. They do have to provide financial documentation. So as long as they are willing to share their financial information as part of that affidavit, they definitely can. Again, part of what we will try to do is have these resources and ways for people to connect to do this on the website once we launch the Afghan Refugee Collective website.
Hi, Lene, we have 3 minutes. Let's track the time. Thank you.
Thank you, Hamed. Why don't we do one more question that I see right here. I heard that there is a public claim asking Washington legislators to work on considering parolees as refugees. Is that right? Can you elaborate on it?
I can answer that. Yes, it's called the Welcomed Act. It's a bipartisan bill that was introduced on September 3rd. Right now, there's action alerts, and I'll include those in the chat to try to get all of our members of Congress, all of our representatives in Washington to sign on as co-sponsors of that bill. Right now, Representative Pramila Jayapal is the only one that has signed on as a co-sponsor. That absolutely should change. Every single one of our House members of Congress should be signed on as a co-sponsor. So there's action alerts calling on them to do so. There's also other efforts outside of Congress to try to get funding support so that they could actually provide the same kinds of benefits. The department could provide the same kinds of benefits for humanitarian parolees. And I'll also add on advocacy, something else we're going to be pushing. The USCIS director has discretion to waive the $575 fee per person. That can be done just by their discretion. So we really need to amp up the pressure to get the director to agree to exercise their discretion and waive that fee.
Wow, that's really important to know. And on that note, I want to thank everybody who is here today, 115 of us strong, for very, very active participation. Thank you so much. And turning it back over to you, Sarah, to wrap up with the panel.
Thank you so much. And I really just want to say thank you so much to Anila, Ariana, and Cordelia. It is wonderful getting to have the opportunity to work with all three of you, and such an amazing opportunity to hear your stories and hear your experiences and the terrific work that you're doing. We look forward to continuing to build our partnership as a collective effort to welcome all of those that are coming to Washington State. So thank you so much. We will be sharing your contact information with everyone as we send out the information for this today's session. So thank you. Next on our agenda, we would like to invite Jasmine Matheson to join us to share a little bit about all of the efforts that are happening across the state as it relates to COVID and to Afghan arrivals. Jasmine, are you able to join us?
I am. Thanks, Sarah. So it's a pleasure to join the Refugee Advisory Council today. And as Sarah said, my name is Jasmine Matheson, and I serve as the State Refugee Health Coordinator with Washington State Department of Health. Washington State Department of Health welcomes all new Afghan community members to our state. And we stand in solidarity and partnership with the community partners who've been working tirelessly to support newly arriving individuals and families. We're committed to identifying all the ways that we can help to provide a healthy and safe future for our newest community members. So today I was asked to share some information regarding medical requirements for new arrivals from Afghanistan, and also some information regarding COVID-19 vaccination here in Washington State. We've heard that there's been a little bit of confusion regarding some of the medical requirements for new arrivals from Afghanistan. So I wanted to take this opportunity to clarify the public health systems that we have in place. Medical screening is a core part of the immigration process, and the requirements are set by the federal government for screening tests and for vaccinations. The Centers for Disease Control and Prevention have been providing updates regarding the medical screening requirements for all new arrivals from Afghanistan. So everyone who's been coming in as part of Operation Allies Welcome at the airports will receive COVID-19 testing regardless of visa status. In addition, for evacuees who are continuing on to the U.S. Department of Defense bases for processing, they'll have repeated COVID-19 testing performed. And this is consistent with the CDC recommendations for travelers returning from overseas. Anyone who tests positive, either at the airport or at the bases, will be isolated and their contacts will be quarantined. So the federal medical examination requirements are set based upon visa type, and anybody who has navigated this or helped family navigate this process knows that it can be very extensive. So for individuals who are part of the special immigrant visa program, when it's logistically possible at the bases, their immigration medical exam is going to be completed per the CDC technical instructions. And I can share the links for anybody who wants to dive into those details. But otherwise, they'll follow the same process as I'll share for the humanitarian parolees. So humanitarian parolees complete a screening examination at the bases, and this includes, at its core, vaccinations and tuberculosis screening. The vaccinations are listed here and include measles, mumps, rubella, inactivated poliovirus vaccine, COVID-19 vaccination, and then others per the CDC technical instructions, which includes kind of that wider schedule of immunizations that we're all familiar with. The tuberculosis screening is, again, per the same immigration requirements that we see for other visa classifications. So just to follow up on the earlier question about insurance and access to health services, this chart provides an overview of some of the health-specific milestones based on the different visa types people are entering after they're resettled here in Washington State. So that top line shows the pathway for folks with special immigrant visas or SISQ status, which is the same as what we see for refugees after arrival. So after resettlement, folks are enrolled in health insurance, they'll complete refugee health screening and continue on to primary care. For humanitarian parolees, as our previous panelists noted, there are some gaps, particularly around health insurance and health screening. So currently in Washington State, humanitarian parolees who are under the age of 19 or individuals who are pregnant are potentially eligible for Apple Health if they meet the requirements of that program. Other adults might be eligible for alien emergency medical if they have a qualifying event, but not the general coverage that we see for others. And these are really big gap areas. We have had federally qualified health centers, primary care providers, and clinics across the state reaching out to affirm their support and interest in caring for these patients, regardless of people's insurance status. And so we're currently working to pull together a list of clinics to be able to share with partners. I did want to switch gears over to COVID-19 vaccination. We do continue to see the impacts of COVID-19 in our communities across Washington State, and vaccination is a critical tool that we have to protect ourselves, our families, and our communities. As of September 20th, 75.8% of Washingtonians ages 12 and older have received at least one dose of COVID-19 vaccine, and 68.9% of people ages 12 and older are fully vaccinated. I wanted to take this opportunity to share more community-specific data from our immunization program evaluation here in Washington State. This evaluation looked at the initiation of COVID-19 vaccination among people who've received a refugee health screening exam from July 2012 to May 2021. The gray bars that are shown here show the percentage of the general Washington State population in each of these age groups who have initiated COVID-19 vaccination. The yellow bars show the proportion of individuals from Afghanistan who arrived in Washington State as humanitarian entrants who have initiated COVID-19 vaccination. And as you can see, the Afghan community has comparable to or higher rates of COVID-19 vaccination across all age groups. Our community-rooted organizations, resettlement agencies, clinicians, and communities have been critical in providing information and serving as trusted voices, helping people really navigate the logistics of getting their COVID-19 vaccinations. I've included information here regarding our DOH Caravan program, which supports mobile access to COVID-19 vaccination through pop-up events and partnerships. We continue to welcome opportunities to support community by bringing vaccination directly to folks. And with that, I will stop here. Happy to take any questions. And thank you all so much for the opportunity to speak.
Thank you so much, Jasmine. It's great to have you as a partner as we work on this. Are there any questions for Jasmine? Jasmine, I have a question for you, and I wonder, not to put you on the spot, but we heard from Ariana earlier today to talk about how we can better help support the mental health needs and providing trauma-informed care to our newly arriving Afghan friends and neighbors. Is there anything that you envision our healthcare system being able to do to help support them? And what can we think about in terms of working together on that?
Yeah, I think Department of Health actually hosted a listening session with community earlier this week and heard this as a huge need area. And I think that we're continuing to gather information to inform what this should really look like, and hearing strongly that we're wanting to support mental health at multiple levels, really the initial community connection, access to support people who are acutely navigating behavioral health needs, but having a community-led approach to doing so. And through the coordination group being led through Anila and Sarah, we're looking to form a health and mental health work group to really inform and drive the response and bring together community-based organizations who have experience already in this area to lead and provide resources. I will say that the gaps that we see around health insurance do present a significant barrier to access and funding to support this work. And that is something that we continue to elevate and share up, needing to find solutions there. And I'd welcome any input from others on this call, as I know that there are experts and folks who've been working in this area as well.
Yes, thank you. And we also welcome anybody who is interested in joining any of those work groups to help think about our collective response, because we think that this is going to take a village to really welcome all these newcomers. So in response to, I think, and related to the Apple Health question, we just wanted to clarify that, can you please clarify that humanitarian paroles, are they eligible or ineligible for Apple Health medical coverage? And will applying for Apple Health impact the process of adjusting their immigration status?
So it's our understanding that individuals who are under the age of 19 are potentially eligible for Apple Health if they meet the program requirements, as are individuals who are pregnant. I can't speak to the impact on adjustment of status potentially, as that would be kind of an immigration legal side of things.
Thank you. Are newly arrived refugees from Afghanistan and others offered a COVID-19 vaccine, or is it part of their required vaccinations?
Both and. So I think that there's been a huge amount of work in the community for folks who are here already to provide COVID-19 vaccination. And then we see that the Centers for Disease Control has added COVID-19 as one of the immigration requirements for folks who are adjusting their status and for folks who are entering as humanitarian parolees. So I think there's both offering and access as well as requirements there. And COVID-19 vaccination is also offered as part of our refugee health screening examination for all our clinics in Washington State.
We've heard from you that many of the Afghan humanitarian parolees may be ineligible for Apple Health or are ineligible for Apple Health. Do you know of any emergency organizations that are any clinics that are covering emergencies like CMAR, or what clinics will provide services to uninsured?
Yeah, so I think, we have clinics throughout the state that provide that emergency net support through sliding fee scales. And so federally qualified health centers traditionally fill that role in our community. We're working to gather a list that we hope to be able to share with information about the different services provided and the fees and kind of coverage pieces for different communities. But yeah, we've definitely had our federally qualified health center partners in particular, as well as some of the county hospitals, et cetera, reach out to really think about how to best support this population.
Thank you, Jasmine. As always, you are a wealth of knowledge, and we really appreciate your expertise on the call and look forward to continuing to partner with you. I think at this time, we're going to go ahead and turn it over to we're very excited about having a client success panel. And so at this time, I'd like to go ahead and turn it over to one of our Refugee Advisory Council members who's going to help us introduce two guest speakers who are going to share their client success stories. Nasreen, are you able to join us?
Yes, I am here. Okay, I'm so happy to be with you all today, and then we will start to introduce our two stories teller today. When we hear the word immigrants or refugee, we may think of people who have been exhausted by life, who have neither strength or power, but in fact, they are strong and brave warriors who have persevered and fought with their last breath in order to start a new life and build a new bright future for themselves and for their children to maximize their potentials. Today, I would love to introduce two of those warriors. The first one come far away from Iraq, and she has a wonderful story. She will share it with us right now. Wasan Hassan, please go ahead.
Hello, everybody. I thank you all for this opportunity to share my success story. And thank you, Nasreen, for introducing me. I would like to start my story, my life story, in 4 different sections because that's how it was. So my first section of life was my early childhood, and I was born in Baghdad, Iraq. When I turned 6, I moved to the US when my father was studying to get his PhD in agriculture from Iowa State University. So I grew up in Ames, Iowa with my 2 sisters, and I learned reading and writing English before Arabic. But my mother was a teacher in Iraq, so she brought us books from Iraq appropriate to our grade level and started teaching us writing and reading in Arabic. When my dad graduated in the early 80s, my family returned to Iraq where my little brother was born. These are a few pictures of my dad's graduating from getting his master's degree. And this was our last visit to Disneyland in 1981 before we returned to Iraq. So then my second section of life started, which was back to living in Iraq. I started middle school in Baghdad, which was a huge turn in my life, but my mother's efforts were a true blessing. It was the basis of my success in high school with excellent grades. I got accepted in pharmacy school, and where my strong English came in handy, and it was the reason I graduated the top of my class with a pharmacy degree from Baghdad University. I worked as a pharmacist in the Ministry of Health for 14 years. During those years, I got married to my wonderful husband, Manaf, who has a master's degree in mechanical engineering. We had our first son in 1997, our second son in 1999, and at that same year, I opened my private pharmacy with the support of my husband and family. When the war started in 2003, we stayed in Baghdad, and we witnessed all the explosions and the violence and chaos that happened after. But we continued to work and try to live a normal life until 2006, when my husband got threatened because of his job in the green zone. And we had to make a decision to leave to Jordan, hoping that in a few months, Iraq will become safe for us to return. So here starts my third section of life, leaving Iraq. I was in my 39th month of pregnancy when we hired a cab to drive us for 19 hours, passing a very dangerous area west of Baghdad to cross the border to Jordan. We left behind everything, our home, car, belongings, pharmacy, and most important, we left our families, our memories, our jobs. 9 months after leaving Iraq, I lost my only brother in an explosion that happened in Baghdad. After that tragedy, we heard that militias took over our house and destroyed our belongings. So we applied for IOM for a safer place to live and a better future for our kids. We were unable to work in Jordan, but that didn't stop us. We volunteered with many humanitarian organizations, and here are some certificates I got from there. After waiting a few years and having 2 more kids, we were told that we will be resettled in Spokane, Washington. My husband and I started reading about Spokane, about the schools, neighborhoods, jobs, and even studied the driving guide and got our permits right away. So here starts my section 4 of my life, which is life in the US. We arrived to Spokane in June of 2010 through World Relief. This was a beginning of our new chapter of our lives. Manaf and I had decided to build a stable life for our kids and teach them the importance of being independent. So we joined a match grant program that was offered to us by World Relief. It helps us find jobs immediately without depending on public assistance. My husband found a labor job at a glass factory, and I was told that my English skills were above the levels taught at the Adult Learning Center, so I was required to do job search right away. I thought maybe I can use my medical background and English skills to work as a medical interpreter. So I researched a little bit and became a certified medical and social interpreter through DSHS. I took both of my tests and became fully certified a few months later after arriving, and I started interpreting all over Spokane. In the fall of 2011, I started school at SCC to obtain my pharmacy technician degree, and I graduated with honors in 2013, hoping to become a pharmacist in Washington State one day. But that same year, I had a stroke, which really slowed me down. And the process of recertifying my credentials was too complicated. In fact, no one was able to guide me to where to start. And this was a very big challenge for my husband and I. In other states, the process is like a clear path and onto how to work in your own profession, maybe because they had more refugees with foreign degrees or because the universities eased that process. But that didn't stop me. I decided to continue my work as an interpreter because I felt that I was needed by the Arabic community more than working in a pharmacy. I continued to improve my interpreting skills and expand my scope of practice. So I did a lot of training to become a court interpreter, and also I interpreted in school districts. I also do over the phone interpreting, and I am currently a tester for candidates trying to pursue a career in interpreting. During the 2020 census, I worked as an enumerator. And when the pandemic began, my role in the community expanded even more. I started working with different organizations like the Zone, Refugee Connections, and joined World Relief as an Arabic community ambassador. I love my role as a community ambassador because I really enjoy helping others and wanted to be the voice for those needing to be heard. I connected families to the health district and resources. I distributed food and supplies to families with the help of my husband, as he was also a community ambassador. I frequently checked on families to make sure that they were doing well. And I also love to volunteer. I volunteered for 40 hours of training to become a sexual assault and a crime victim advocate through Lutheran Community Services, and I worked on the hotline. Also, I foster kittens for a local shelter. Now to my family. I'm a proud mother of 4 kids and 4 cats. My oldest son is a software engineer in Seattle. My second son graduated this year from Whitworth University with a biochemistry degree and in the process of applying to dental schools. My third child is a sophomore and dreams of becoming a pharmacist. And my daughter is in middle school and she hasn't made up her mind yet, but she might become a vet because she loves animals. My husband, Manaf, is currently working as a bilingual specialist at high schools in Spokane, helping all English learners in math and science. He was also unable to work in his field, but used his knowledge to help students. In our free time, we love to go on road trips to discover the beauty of the States. And we love to cook Arabic food and invite our friends to share meals with us. I want to thank you all for this opportunity to tell my success story. And although I am very thankful for my success and my husband's success, but we really wanted to work in our own profession. And I'm working on doing research on how to make it possible, maybe not for me, but for future refugees and immigrants that were successful back in their countries to be successful here in their new home. Thank you so much for this opportunity.
Wasan, thank you so much. It's a wonderful story, and this has inspired all of us, and it tells us nothing impossible. We can do whatever we dream, and you make it, and you brought a brighter future for your kids, and we could see the result. Thank you is not enough. Now we will introduce another warriors. She came also from far away. She came from Ukraine, and she always dreamed to be here because she knows here the country of a new start. Will introduce and welcome Ariana Duyonko. Welcome, and please share your wonderful story with us.
Hello everyone. My name is Olena. I'm from Ukraine, and I want to share with my successful story. I have lived in the USA 3 years, and truly to say, I like my life in America. And when I live in Ukraine, I know that the United States is a country of possibility, and I saw without hesitation, I took the chance to move to the United States of America, and I do not regret about my decision. And I want to say a few words about my life in Ukraine. In my country, I have big family, happy family, and I had higher education. I was a teacher in primary school. I worked as a teacher more than 13 years, and I like my job very much. And I and my friends, we created the children volunteer organization, Wonderland, which called Wonderland, and we helped teachers and parents to spend time with children. Also, in more than 10 years ago, I visited Ghana, African country, where I have missionary trip. We worked with children at school. It was a wonderful time. And with my organization, Wonderland, we cooperate we are almost all over my country. But in 2018, I left everything in my country. I left my family, my career, my friends, everything. And so 3 years ago, I started my life with clearly a page. And first of all, I met with Dina, who is representative of this organization. She helped me to did my first steps in real American life. And first of all, I decided to go to college to improve and to learn my English. I took my ESL classes, and 1 year later, I I began to study at Edmonds Community College, and last month, August, I have received my certificate, and I have new education in America. But it is not enough for me. So this quarter, I decided to receive, to earn new education. I want to receive office administration and supervision associate degree. And I think I do not dwell, and I will continue my study at university because I have opportunity here. And also I have big dream to create the same volunteer organization here. I want to work with children because it is my hobby. And last summer I had chance to work in children summer camp. It was wonderful time. And I want to say a few words about my family. I live with my mom. She is a senior. And I would like to take opportunity to say thank you, your organization, and especially Dina. She helped my mother to got SSI, home care, and other financial aid. And at the beginning, we lived in low-income housing, but now I have opportunity to live in a new apartment, nice apartment. And I want to say a few words about my work in the USA. As soon I arrived, I was working as housekeeping. And in 2019, I received the home care aid certificate and began to work as caregiver. And I'm currently work as a caregiver, and I'm a full study student. And I know my English is not perfect now, but I am working about my English. I watch different program, read book, and I hope it will be everything good. And I want to say thank you for your help and the support for us refugees. And your help is significant, and we appreciate it. Thank you very much.
Elena, thank you so much. And your English is perfect, it's just perfect.
Thank you.
And we love to have you here. And, English, not just the language. We're here all together, we can make a difference. And communication is a key. And you have a skill, you're talented, and you brought a lot to this community and to this country. And we really appreciate you and Wasan and everyone who's coming here. We're in the country of together we can make a difference, and tomorrow is better than today, and we can make it. Thank you so much. We appreciate your story, and we wish the best for you. And we wish to see you with us also on a board. Thank you again to you and Wasan. Sarah, back to you.
Thank you so much, Nasreen. It's really wonderful to hear from from all of our guests. Wasan's story was beautiful, and Olena, it's so wonderful to hear from you as well. On a side note, we did receive some slides from Olena that she is actually an artist as well, and so we have beautiful pictures of her paintings from her trip in Ghana that I'm going to take 1 minute of pleasure to share with all of you, because I think we all need moments of joy in our life. So you are truly talented, Olena, and thank you for sharing them with us.
Thank you.
And Nazreen, thank you for doing such an amazing job with that panel. That really brings us to just an opportunity for all of our attendees to ask any additional questions that you may have, any final things that you would like to ask any of our panelists or any of our guest speakers today. Is there anyone who has anything that you would like to ask before we close our session? Amira.
Hi, everyone. Yeah, my question is about the EAD card, the work authorization. You answered about those related to the military. What about others? How could they get the EAD?
So I'll answer and then I'll allow any of our other experts to answer what they know. So most of the people that we're going to be welcoming in Washington State will be coming from the military bases. And so we're going to see the highest volume across the country, about 70,000 people that are coming from the military bases, where they would have been processed for health screening, security screening, and they'll be applying for the work authorization or employment authorization document through the United States Citizenship and Immigration Service. We have heard that some people may opt to not go to the military base, and they will probably need to apply through the designated channel with the United States Citizenship and Immigration Service to apply for an employment authorization document. And Anila also talked about how all of those that will be coming under the humanitarian parolee status will need to find some mechanism to apply for lawful permanent residency. And that might be applying for family reunification if you have a US citizen or green card representative in your family, or it could mean applying for asylum as well. And so part of our working group is to establish immigration lawyers and collectives that can help people to do that. That's a good question, Amira. Thank you.
That's informative. Thank you.
While we wait for any other questions or comments or announcements that people would like to make today, I will let you know that we do have 3 open positions on the Refugee Advisory Council. There's one in the King County area. A second is in Spokane, and the third, I'm actually in Tacoma. Yes, and so we are currently interviewing individuals who are interested in applying in Tacoma. And so if you're interested, please email Hamid Hakim Kel, who will send you an application for your submission.
There is a question. Do we provide a copy of the chat to?
The session today is being recorded, and so if you're interested in looking at the chat, that might be the best way to access it. We will also see if we can provide some of the information or the questions asked and answered in the chat. Any other announcements, questions, comments, final words from anyone who spoke with us today?
I just wanted to say, Sarah, just a reminder again, there's a cooking class. I put it in the chat, but I'll just uplift that. There's a cooking class this Sunday at 2 p.m., an Afghan cooking class. It's virtual, and you can learn how to make the traditional and signature dish of Afghanistan called Kabuli Palau. And it's the ticket sales will benefit the joint campaign for helping incoming Afghan refugees. So I will put the link for that as well in the chat.
Thank you, Anila. And I see that there are 2 hands raised. And so, and if you have entered any questions in the chat that have not been responded to, we will definitely get to you over email. So please make sure that we have your email or your contact information. I'm going to invite Krista Shaw from Renton Technical College to speak.
Thank you so much for the session today. My question is, what is where do you want us to go who have questions after this session today? Because we'll have them. Thank you so much.
Excellent. I would invite you to send any and all of your questions to DSHS or Araya, and Hamed will put it in the chat, and we can make sure to funnel it to any of our panelists as well if we need specific information. And we can also compile it into a sheet that we'll share with everyone. So Hamed, can you please put the Araya info at dshs.wa.gov into the chat so that anyone who has any additional questions or comments or concerns can please send them to that general mailbox, and we can get them to others as well. There's one more person in the attendee section, and then I'll call on Amira and Nazreen. Olga Walker, would you like to make a comment?
Oh yeah. Can you hear me now?
Yes.
I finally unmuted myself. Guys, I just want to address all the participants of today's meeting. And every time I attend the Refugee Forum, I'm always at awe of courage and bravery and all the abilities that people show when they arrive to US and they're rebuilding their lives. And I know I am an immigrant from Russia, and 30 years ago, I went through some of the experience that you are describing. So I personally know how hard it is. So, and I would encourage you, do not give up, just keep going. I think Churchill said, if you're going through hell, just keep going. So if at some point it is very, very difficult for you even to make a next step, just keep going. You'll get there, keep going. Thank you so very much for sharing your personal stories. Really, really appreciate it. That's all.
Thank you, Olga. We appreciate your comments. At this time, I'm going to ask Amira to go ahead and unmute.
Yes, Sarah. I was reading, I was looking for the link for the cooking class. What did you say?
You have your hand raised. Would you like to make a comment?
No, I lowered it long time ago.
Okay, great. Nasreen.
Okay, I will comment on Anila announcement for the Sunday. That's a creative idea, Anila, which who does not like food? I'm sure that will be successful. We're glad to hear this idea. And then another thing, on behalf of the Kennewick School District, we're so excited to receive our student from Afghanistan, and we're starting preparing and making sure we have everything need for those students to put them in the right classes, and also provide the mental health support and more. We also today in the process to hire a new interpreter and welcome her to our team to be the parents liaison between us and those new family. And again, thank you everyone who attend our forum today.
Thank you so much, Nasreen. And we have one final comment from Linda Farron in the attendees. Linda?
Yes, I put it in the chat, but I've been hearing people talk about folks who come with professions, with degrees, and the Puget Sound Welcome Back Center at Highline College can help people navigate systems to get back into their former profession if that's what they choose. And so it's easy to find, Puget Sound Welcome Back Center. We can help anyone in the state. Because the licensing in the state is the same for people living in Spokane and people living in Renton. So we welcome those inquiries.
Thank you so much, Linda. We really appreciate all the work that you do at the Welcome Back Center. All right. I want to thank all of you for your time and attendance today, and an extra shout out to all of our panelists for the courage that it takes to share your stories and to share the information with us. We really value your voices and appreciate your time. And thank you, as always, to all of our Refugee Advisory Council members. We appreciate your time and your participation. Thank you to everyone who attended. Have a wonderful weekend.
Thank you. Same to you.
Bye, everybody.
Bye.
We have